School's back in session for most, and that often presents some challenges for your child's health. Dr. Jason Church is with the Ogden Clinic, and he joins us this morning with some tips on how to keep our students healthy and happy through the year. Dr. Church, thanks for joining us this morning.
Thank you, Glenn.
When children get their checkups, is it important to have that done every single year for your child?
I think it is. That's the recommendation after age 2 to have that done every year.
And what kind of things should you be expecting to have done during these checkups? What sort of things will doctors do?
Well, it should be a complete examination, evaluating the whole child, not just physically, but also developmentally, emotionally, and socially.
What would you say is probably the single best piece of advice you could give parents? You know, we send our children off to school, and there's a lot of things going around in there, you know, over the course of the year. What's the best piece of advice you have for parents?
Well, it's the same as in any environment. Hand washing is the best advice to prevent the spread of germs. Also, not sending your kids to school when they have a fever. If we kept more kids home when they have a fever, we'd have less of that spreading around.
Is that the key, really, when there's a fever? What if your child's just kind of having the sniffles, maybe a little runny nose? Do you need to keep them at home in those cases, too?
I think it depends on the severity of that. Fever is definitely one of the big factors. If your child can't sit through class without coughing continuously, constantly having to wipe his or her nose, then we probably need to keep them home too.
Are there certain things, certain conditions you find over the course of the year that are just typical? We know that when December rolls around, we're going to have this. February, we'll have this. Do you see that typically? Sure.
The next couple months actually is a big slowdown for us in terms of illness as kids all get back into school. It takes a couple months for the weather to cool down. Come November, end of October, we know that we're going to start seeing flu, lots of different cold viruses. RSV season is usually towards the end of the year, beginning of the new year.
There's a lot of time when we see those diseases coming around in winter times because people are kind of confined more inside and we get everybody kind of plugged into one area.
Yeah, for sure. The cold weather plays a part, but it does drive all of us inside. The holiday season, we all get together. Especially when we get lots of kids together, they share lots of germs.
When parents have that fever or even that sniffle, is it important to call your doctor and get to the doctor, or is that something you can treat at home?
Well, I think most of the sniffles and average cold can be treated at home. Things that should concern you, especially with kids, if they have higher fevers, difficulty breathing, if they're especially lethargic. In general, with my office, we usually suggest, you know, try and manage that at home for 3 to 4 days unless there are more serious symptoms. If it lasts longer than that, then you might want to give us a call or make an appointment.
Sounds like the best piece of advice from this, though, that I at least picked up from you is wash your hands. Yeah, very simple.
For sure.
Keep washing your hands, and that'll help with a lot of these problems.
Yeah, absolutely. You know, one other thing I'd like to say is that even before the day starts, getting a good night's sleep is extremely important. We're learning more and more about how much sleep affects our health. That's especially true for kids. You know, infants need 18 to 20 hours of sleep. That slowly decreases to adolescents, 8 to 10 hours. But sleep is really important.
Keeping your body strong and immunity up.
It does, yeah.
Wonderful. Dr. Church, thanks for joining us from the Ogden Clinic. We appreciate your expertise. Of course, all this information is going to be on our website as well. Thanks for joining us.
Thank you, Glenn.